Good morning, everyone. Thank you for joining us today. We'll start off this session with the epi summary. So let's jump right in. So we've changed things a little bit for this first part. Instead of looking at the situation around the world, we're going to do a bit more of a focus in on Canada, then jump into Ontario, and then what's happening locally in Windsor-Essex. So this is the epidemic curve by reported date for Canada. So we can see that right now cases in our country is continuing to increasing, but it's not all due to what's happening in Ontario, as we'll see in the next slide. Cases in Ontario have plateaued and at times have decreased over the past couple of weeks. Um, Especially yesterday, we saw cases that were in the 500 range. And the same holds true to what we're seeing also in Windsor-Essex. In Windsor-Essex, the cases have actually declined. Our 7-day average in terms of case counts has dropped to 42.6 cases per day, whereas this time last week we were at 60.3 cases per day. Just like with our 7-day average, our case rates too, week over week, has dropped. Currently, our most completed week's rate is 66.4 cases per 100,000. This has dropped from where we were last week, which was at 97.6 cases per 100,000. In the most recent 7 days, our case rate is 68.9 cases. Once again, this is a drop from the same time period as last week, where we were at 93.9 cases per 100,000 population. When we compare ourselves to the Southwest region with other PHUs and across the province, we see that our rates, though they're higher, have declined, and are approaching the rates for the other regions in the province and also the rates in Ontario. Additionally, when we examine our wastewater surveillance data in our red line, we are seeing once again that in the past 2.5 weeks or so, we have seen a decrease in our wastewater data. This figure here looks at our tests and our percent positivity of those tests. For the week ending on September 18th, our percent positivity was 3.9%. This has decreased once again from where we were last week, where we were at 6.4%. Last week too, we saw a higher number of cases completed. We approximately did about 7,500 tests for all of last week. When we look at the most recent 7 days and what the percent positivity is for Ontario, Windsor-Essex has dropped to having the second highest percent positivity. Only Chatham-Kent has a higher percent positivity. In the past 7 days, our percent positivity is 5%. This is still higher though than what we're seeing in the province, where we're sitting at 2.9%. Just like with our overall percent positivity, we have seen a decrease too in our percent positivity across our age groups. In the last couple of weeks, we had a higher percent positivity in our younger age populations, 0 to 17 and 18 to 34, but that too has dropped. Currently, our 0 to 17 year age population is sitting at 3.5%. When we look at our case rates per 100,000 population by municipality for the month of September onwards, we see that Kingsville, Leamington, and Windsor has the three highest rates so far. When we strictly look at the number of cases and how they were distributed across our region in the past 30 days by municipality, we see that 60% of our cases are from Windsor. However, we are seeing more and more cases in the other towns as well. For example, Leamington, LaSalle, Lakeshore, Kingsville, all make up about, give or take, just under 10% of our cases in each of those areas. When we look at the past 7 days, Windsor once again accounts for the most number of cases at 59%, whereas Leamington and Lakeshore respectively both make up 10% each. Here we look at the overall cases by age and sex and what it compares to in the past 2 weeks. So we see that in our 0 to 19 age group, about 30% of our cases in the past 2 weeks were amongst this population. Whereas if you compare since the beginning of the pandemic, our overall distribution is about 14%. This is still high for what we should be experiencing for this specific age group. And this age group too is typically those who are not eligible to get the vaccine or have a lower vaccine coverage rate. When we look at how cases have acquired COVID-19 from the month of September onwards, there is a mixed source of acquisition from close contact to community acquisition to your household contact. When we try to quantify that, we see that about approximately 33% of the cases in September up until now have acquired COVID from a source that they're not aware of. Whereas approximately 31% of the cases have acquired COVID from their household contact. This is a new slide that we have reintroduced, which looks at our school-aged children in Windsor-Essex. In the second wave in December and January, we saw a high volume of cases across the region in our school-age population. We are seeing similar levels to that now in our fourth wave here in Windsor-Essex, though it is on the decline. When we compare our 7-day average trends in school-aged children and to our overall population, we see that there is a disproportionately higher number of cases in school-aged children relative to the other age groups. Here we're looking at our variants of concern cases. In our third wave locally, we saw that the majority of cases were the alpha variant found in the blue color that dominated our region. Now, however, the Delta variant has become the more dominant strain and accounts for the majority of our cases, which is found in green. When we compare our hospitalizations in Ontario and Windsor-Essex, we are starting to notice a different trend here. Hospitalizations has been on the general decline in Ontario for this past week, whereas we are seeing a slight increase locally in Windsor-Essex. When we look at our ICU data as well for Ontario and Windsor-Essex, it does follow a similar trend to our last slide, where we're seeing a slight increase in our ICU admissions for this past week, whereas in Ontario it has either stabilized or we're seeing a slight decline. Now, when we revisit our doubling time, in Windsor-Essex, found in the dark blue line, our doubling time remains largely unchanged from where we were last week, minus some variation over the past couple of days. In Ontario, the doubling time has improved, which means it's increasing, and it's currently better than what we're seeing in Windsor-Essex and in Canada. When we look at Canada, the doubling time remains low due to activity from that's occurring in other provinces. The most recent estimated median R naught is 0.9. This is the same as last week, where we're roughly at 0.87. When the R naught is less than 1, each existing infection leads to less than one new infection. This signals that our cases are decreasing. Now moving on to our vaccine status. This slide provides us with a breakdown of our doses administered over time. As you'll notice that we have also added in our third doses, and overall, our dose administration has declined in the month of August and in September, minus some minor spikes that we've seen in the uptake towards the end of August. In the past 7 days, 58% of our doses were second doses. We're currently administering about 415 first doses daily in our region. This has decreased from last week where we were doing about 470 first doses. Just zooming in into what we're seeing from September onwards, and we'll see that once again, we are seeing a decrease in overall doses administered in our region. When we try and quantify the 7-day average, just like how we're seeing the last two slides, our 7-day average in terms of doses administered has continued to decrease, though we have seen a slight boost just because of our implementation of our third doses. So if we take into account what has happened with our third doses, our overall dose count remains roughly approximately unchanged from this time last week. Now looking at our coverage rate by overall age and by our age groups. Overall, if we include our entire population, at least 72% of our residents have received at least one dose. We have immunized over 82% of those who are 12 years or older with at least one dose. When we look at our fully vaccinated group and our coverage rate, the highest group is in our 80 plus population with 96% coverage. Our and in our 12 plus coverage age group, the rate is 75.5%. We're steadily getting to where we need to in terms of our coverage rate for our region. Focusing on our hotspots, and our overall hotspot has a coverage rate of 66%. This is slightly lower than what we're seeing for our overall coverage, which is 72%. When we break down our hotspots, there are some areas that are doing really well, such as our N9Y postal code. Whereas in the downtown area with N9A, it has our lowest coverage rate. The similar trend in the last slide is followed when we look at our fully vaccinated population as well. The N9Y has a higher coverage rate for those that are fully vaccinated compared to those in the N9A, which have a lower coverage rate. So how are we doing when we compare ourselves to the rest of the province and to the other health units? Once again, as just like last week, we're on the tail end or in the bottom half in terms of where we are with a 12 plus population coverage rate for our first doses, which can be found in the green line, and we are also below what the coverage rate is for the entire province, which is found in the orange line. As with our first doses, we see that similar trend when it comes to second doses as well. And we're slightly even further behind when it comes to fully vaccinated coverage in comparison to other regions in our province. So we looked at our cases and their vaccination status from August 23rd to September 19th. The overall risk of acquiring a COVID-19 infection among those unvaccinated is 6.3 times higher than in those that are fully vaccinated. What this means is that, you know, those that are unvaccinated can acquire COVID-19 at a higher likelihood than those that are fully vaccinated. If you're fully vaccinated, that doesn't mean you will not acquire COVID-19, but the likelihood is much lower compared to those that are unvaccinated. So in summary, just like last week, our case rates have decreased again, and our wastewater surveillance data highlights that too. Though we are seeing an increase in our hospitalizations and ICU admissions over the course of last week. Our first and second dose coverage rates has largely remained unchanged or has slightly decreased in comparisons to the week prior. When we look at our monitoring indicators, we are seeing a decrease in our case rates for the most completed week, which sits at 66.4 cases per 100,000 population. In the past 7 days, the rate is 68.9 cases per 100,000 population. Our percent positivity sits at 3.9% for the full week, whereas in the past 7 days, it's slightly higher at 5%. Our median R effective is at 0.9, signaling
I believe we may have lost Ramsey.
Thank you.
Oh, Okay, we lost your first sentence, Ramsey. Could you repeat that?
Our first dose vaccination rate for those 12 plus is at 82.2%. And for our fully vaccinated residents that are 12 plus, it's at 75.5%. Thank you.
Okay, we'll now
Ramsey,
take. Oh, go ahead.
Ramsey, it's Shankar. I enjoyed that presentation. I was just wondering, in your when you look at the data overall, where do you, is there a way you could comment on where Windsor-Essex is relative to other health districts in the province with regards to the burden of illness or burden of COVID?
We're currently the second highest. Chatham-Kent currently has surpassed us with where they are and their burden, as we'd say. Um, so other regions do though have a higher vaccination rate, which is something that we can look to improve towards. So that is kind of offset with the high number of cases too that we're seeing in our region as well.
Okay, so when you make that determination, I suppose you include the number of cases per 1,000 people, percent positivity, the number of new cases, the total number of cases that are currently active. Is that a fair characterization of how you make that determination epidemiologically?
That and also the number of outbreaks we're seeing and how cases are acquiring too. So we see a third of our cases don't know how they're acquiring COVID, and a large number of cases also, another third actually, are acquiring from the household contact. So we're seeing transmission in various settings or in settings where a case may not know what's really happening or how they're acquiring it.
That's great. Thank you for helping me understand that just a bit better. Thank you.
Thank you, Ramsey. We'll now take questions from the media. Today we'll start with Taylor from the Windsor Star.
Yes, good morning, Doctor, and good morning, Ramsey. Thank you for your presentation. I suppose for residents wondering, looking at this data and seeing the decline, what can we attribute the drop in case rates, the apparent decline that we are seeing now to? What is working for the region?
So Ramsey, do you want to comment, and I can supplement that as well?
Well, we have seen, a steady day-over-day increase in terms of our vaccination coverage rate. It's not where we want it to be, but we're slowly getting there. I think too, from a health perspective too, and Dr. Necessary can speak more to it. We have implemented some additional measures in our region, which has also helped to curb the transmission. So both hand in hand have had an impact in our area.
Yeah, so from my perspective, one has to be always cautious in interpreting the data, especially a limited number of data points. I think the real message I would take from this data is that some of the indices of disease severity or COVID burden have improved, but also that Windsor-Essex is at the very top, or has the greatest or near the top burden of COVID-19 in the province. And also Windsor-Essex has probably had in the past and previous waves has had longer periods of lockdowns, and I think Ramsey can maybe comment on that, and greater restrictions. So given all of that, I would be cautious about how we interpret the data. It is better. Some of the indices have improved, but we still have a long way to go to get Windsor-Essex to get COVID-19 under control in the community.
Thank you.
Any questions from Aaron at AM 800?
No, I'm okay.
Okay. Any questions from Melanie at CTV?
Yes, good morning. Would you say, looking at the data, that you would be confident enough to say that we might have reached the peak of the fourth wave in the region now that things look like they're getting better?
Well, we never predict the future in medicine. you know, I'm hopeful that the burden of illness will decline as time progresses. But I don't think we can make those predictions at this point in time.
And I would say too that I'm cautious as well, because we are seeing a large number of school dismissals and school related outbreaks as well in our area, and you know that it might be a temporary thing, or it might increase over time. So we're continuing to monitor that and to see where that goes. But I think right now it's still a little early to see if we're past the fourth wave, or if it'll be a continuation.
Okay, thank you.
Any questions from Lauren at CBC?
Hi there. I'm actually just wondering, Dr. Nasathrai, if you can speak on the enforcement blitz that's actually going to be occurring soon. It was mentioned during the presentation yesterday. I just wonder if you're able to speak on that at all.
Yeah, and on those operational matters, typically one of the administrative team comments on that. Nicole hopefully will be joining us before the end of this session, and
Okay.
if not, I can perhaps have her respond afterward, or Mike can maybe facilitate a response either on electronic format or in some other way to respond to that. Does that seem appropriate?
Absolutely.
I can speak to that actually,
Oh,
Dr.
Eric, there you are. Go ahead.
Yeah. Hi, Eric Nadalin. I'm the Director of Health Promotion responsible for enforcement work at the Health Unit. The enforcement blitz, it does start today. We've worked with other provincial partners like the Ministry of Transportation, Ministry of Environment and Climate Change, Ministry of Finance, AGCO, and other partners to bring additional enforcement officers into our region. Our focus today and into the weekend will be just to make sure that people have a clear understanding of what the requirements are for the vaccine verification process, and make sure that the letter of instruction continues to be adhered to. And we're optimistic that compliance will be good over the weekend, and appreciative of the additional supports.
Great. Thank you very much.
Any questions from Adele at Blackburn?
Yeah, just a couple. Eric, first of all, could I get the spelling of your name and your position again?
Yeah, it's Eric with a C, and my last name is spelled N, like in November, Adalin. And my position is Director of Health Promotion.
Health Promotion. All right, I got one other too for Ramsey. Ramsey, can you tell me what your last name and position is? Oh, and how to spell your first name?
Yeah, for sure. Ramsey, RAM, as in May, SEY.
Okay.
D'Souza, D''Souza. And I'm the manager of epidemiology and evaluation.
Epidemiology and eval. Okay, perfect. I just a quick question, and maybe Ramsey, this is for you. Maybe this is for you, Dr. Nazarathu. Our vaccination rate for 2 doses has been very stubbornly climbing, just really slow. And I know that we've been harping on this for what feels like forever, but it has been months that we've been harping on the necessity of getting your vaccination. Is there anything you can say at this point? Because are we looking at the holdouts at this point? And is there anything you think you can say to change people's minds?
Well, you know, I think that we always remain optimistic that people who are not vaccinated will get vaccinated. I guess the core message I would have for people who aren't vaccinated is there's approximately 70,000 people in the health district who are eligible for vaccine who have not got vaccinated. We know that if you get vaccinated, you're less likely to get infected with COVID-19. You're less likely to get sick from COVID-19. You're less likely to go to the hospital and be admitted with COVID-19, and you're less likely to die from COVID-19. And I think the evidence suggests that if you're vaccinated, you're less likely to, if you get infected, give it to somebody else. the message I would share with people is that if you that if you get COVID-19, not only does it affect you, but it affects everyone else in the community, because if you have to go to the hospital and the burden of illness is right now, the people who are mostly going to the hospital are the unvaccinated. That means that other people who need other health services cannot get treatment. I think that, and Ramsey can correct me, but I think between 200 and 400 people in this province, on average, it's many hundreds who are occupying ICU beds, and we can get the exact number for you, who are occupying ICU beds right now in the province. So if you are unvaccinated and you get sick, you're taking or crowding out health services for other people at the hospital level and at the outpatient level. So I think that's another reason. So fundamentally, if you cannot get vaccinated for yourself, if you're currently unvaccinated, I would appeal to you. We would appeal to you at the health service that at least if you can't do it for yourself, do it for your family, do it for your friends, do it for your children, do it for your mom and dad, do it for your husband or wife. Because it's just not you, but it's also all the people around you. Also, how we manage exposures in schools is in some way modulated, and in the future will be modulated by the vaccination coverage rates. And if we can get vaccination coverage rates in schools to the same level that we have for measles and other childhood vaccines, I think that would be an outstanding improvement for the health of the community. Ramsey can share with me the exact data, but I think approximately 90% of school age young people are vaccinated for the vaccine for the vaccines required by the Immunization for School People's Act. And I think that we're running around 50 to 60%. Ramsey, you can correct me on the data elements again, but we're running around between 50 and 60% for young people going to school right now. If we can get the COVID vaccine rate, which is between 50 and 60%, to the same level as we have for other childhood vaccinations, which is around 90%, that would make a huge difference and help us try to keep schools open during this pandemic. So we are appealing to people. I remain optimistic that dialogue will improve the number of people who get vaccinated. But I also appeal to the unvaccinated that if they can't do it for themselves, do it for their friends, their families, their children, their parents. Sorry for being long-winded on that. Ramsey, do you want to supplement my comments or correct any of the data elements?
No, you're spot on.
Now, I got to think, though, that we're now 19 months into this. There has to be some disappointment on part of public health officials with the slow climb here. Are we still fighting a battle against misinformation?
Well, I think the way I would characterize this is that we continue to put forth the public health message based on the data that we have. I would ask, and I would share that public health officials and medical officers of health, who are doctors, try to give the best possible advice that we can to the community. It's okay, it's okay to have dialogue and to seek clarification of data elements and clarification of advice. But I think that from my perspective, the most important thing is to consider the source of the information, and as it relates to public health matters, to rely on the public health service to give an accurate and fair characterization of the data and the recommendations. So our core recommendations right now, based on the data that we have, is 1, if you're not vaccinated, get vaccinated. 2, wear a mask indoors. 3, wear a mask anytime you cannot be consistently and reliably 2 meters away from another person. Reduce the number of human-to-human contacts that one might have. Those are some of the core recommendations that we would put forth. And importantly, if you're sick, stay at home. If you have children that are sick, keep them at home. And we can just keep emphasizing the core public health messaging.
Thank you.
Welcome, Nicole. We're going through the additional questions, and we'll go back to Taylor from the Windsor Star. Any questions or additional questions?
Hello, Nicole. No, I have no additional questions.
Okay. Any additional questions from Aaron at AM 800?
Nope, get everything I'm looking for.
Okay. Any additional questions from Melanie at CTV?
No, thank you.
Any additional questions from Lauren at CBC?
Hi, Nicole. It was answered. Thank you.
Okay. Any additional questions from Adele at Blackburn?
No, I'm good too.
Okay. Thank you, everyone. Have a great weekend.
Thanks, everyone.
All the best.
Thank you,
Thank
everyone.
Bye-bye.